My name is Caroline Xavier, this is Jessica Solis, and this is Samantha Martin, and we did our project on Cushing syndrome. Cushing syndrome is the hypersecretion of cortisol from the adrenal glands. There are many causes of Cushing syndrome. One of the causes is excessive corticosteroid use. However, this is not as common as the presence of a pituitary tumor. You can also have a presence of an adrenal tumor or hyperplasia of the adrenal glands. Typically, ACTH is secreted from the anterior pituitary gland, and then the secretion of ACTH stimulates the production of cortisol from the adrenal glands. However, with Cushing's, the pituitary tumor causes an oversecretion of ACTH and therefore an oversecretion of cortisol. Current research has also indicated that ACTH and the pituitary tumor can be due to an overexpression of TR4 nuclear receptor, and those with Cushing's disease have an overexpression of that receptor, and medication that would suppress this nuclear receptor could aid in the treatment of Cushing's. Some of the typical manifestations that you see with Cushing's is that the client will have a round face or a moon face. You'll also see that they have fat deposits in their subscapular area, known as a buffalo hump. You can also see that the client will have truncal obesity, but their extremities will be thin and frail. Their extremities and their musculoskeletal system is also weak and prone to spontaneous fractures, osteoporosis, and also aseptic necrosis of the femur. The client can also have cataracts or glaucoma. They may also have mood alterations, psychosis, thinning of skin, striae, hypertension, heart failure, and a decreased inflammatory response, to name a few.
The labs that you will see in these patients include elevated blood sugar, elevated sodium, decreased potassium, decreased calcium, decreased eosinophils, and increased white blood cell count. In order to kind of counteract some of the symptoms that happen or manifestations that occur to a person with Cushing syndrome, they're going to change their diet. Their diet is going to compose of low carbohydrates, low sodium, high protein, high calcium, and high vitamin D. This is going to be due to, for example, the high calcium and high vitamin D is going to be to help the osteoporosis that occurs because of the Cushing syndrome. The high protein is going to be to help with the muscle wasting, kind of minimize that wasting that's occurring. And the low sodium is going to be for the weight gain and the edema that occurs through this process. Now, how do you diagnose Cushing syndrome? First, you're going to see these manifestations. You're also going to see the labs. Once you see this, you're probably going to do a 24-hour urine collection test. During this collection test, you're going to look for free cortisol levels. Then you will also do a dexamethasone suppression test. The dexamethasone suppression test is given to the patient or the client around 11 p.m. or before bedtime. And then the cortisol levels are checked at 8 a.m. the next day. If these levels are not suppressed, then Cushing syndrome due to a pituitary tumor is probably what's going on. If levels are suppressed, then you're going to know that it's not a pituitary tumor specifically. And I keep saying pituitary because I actually read this in a research article that is pretty much what you're going to see with the pituitary. You're also going to do a salivary collection test, which is usually done at midnight. You're also checking for cortisol and ACTH levels. The patient is also probably going to get an MRI or a CT scan. This is going to be done to look at the adenoma, see where it's located, see how far it's gone, just to make sure that the tumor is there.
So how do you prevent this? Unfortunately, you really can't prevent Cushing syndrome unless the only reason for you having Cushing syndrome is the chronic use of steroids. In that case, tapering off of the steroids will decrease the Cushing syndrome symptoms, but you have to taper them off and can't stop them abruptly. If you stop them abruptly, it may cause what's called an Addisonian crisis, which is where your body stops producing cortisol altogether. This will actually cause the opposite of the labs and even most of these symptoms than Cushing syndrome, and it's called Addison syndrome. But the good news is that there are plenty of treatment options for Cushing syndrome, and most of these symptoms will be relieved by these treatment options. So your treatment options are dependent upon why you have Cushing syndrome to begin with, whether it's a pituitary tumor, adrenal tumor, or we've already talked about if it was because of the steroid use. You can use radiation therapy to shrink the tumors at the pituitary level or the adrenal level. This will help relieve some of the symptoms. There are also many medications that you can use, including aminoglutathione, which is an adrenocorticoid steroid inhibitor. This decreases the adrenal hormone synthesis and provides short-term symptom relief for clients with Cushing syndrome. So this medication is not a cure, but it does provide some relief for the symptoms that these clients show. Ketoconazole is an adrenocorticoid steroid inhibitor. It's actually an antifungal agent, but when it's taken in high dosage, it will inhibit adrenocorticoid steroid synthesis. Mitotane suppresses the action of the adrenal cortex, and if you remember from Caroline talking about earlier, the adrenal cortex is where cortisol is released, and that's why we're having this Cushing syndrome to begin with. So the mitotane will suppress the action of the adrenal cortex, which will not release the cortisol levels. And then the spironolactone is an aldosterone antagonist. It is a potassium-sparing diuretic, and it's used when bilateral adrenal hyperplasia is the underlying cause of this condition. Some other treatments are the surgical removal of the pituitary gland and the surgical removal of the adrenal gland. These are actually the most common, and our research articles have proven that, because the pituitary gland tumors and the adrenal tumors are the most common reason for Cushing syndrome. So if you just go ahead and take out those glands, it will relieve the symptoms of Cushing syndrome. Now, I don't want to say that it's not going to cause other problems in the body, of course, but it will relieve the Cushing syndrome manifestations. Where as client needs are concerned, it's very dependent on their treatment options. For aminoglutathione, you can use this drug no more than 3 months. You need to monitor their blood pressure for hypotension, monitor fluids and electrolytes for the clients with gastric effects. Ketoconazole can be used in addition to radiation or surgery. You need to monitor their liver enzymes and for indications of liver toxicity. You also need to monitor their fluids and electrolytes for clients who have gastric effects. Mitotane is used to treat the inoperable adrenal carcinoma. You need to monitor for indications of shock and hepatotoxicity. Spironolactone, you need to monitor the electrolytes, especially sodium and potassium, because like we said before, the spironolactone is a diuretic, and so the client will lose a lot of their electrolytes in their urine, so you need to be very careful that you monitor their electrolytes. You also need to monitor their vital signs and weight. As far as client education is concerned, you need to explain to the client the risk factors like the glucocorticoid use that can cause Cushing syndrome. You need to tell them the treatment options and explain what kind of symptoms they may get from the treatment options themselves. You also need to tell them the signs and symptoms that they may get from Cushing syndrome, and it's very important to remember to tell them that a lot of these signs and symptoms are reversible and will go away to decrease their anxiety level about this disease. One of the biggest client needs is infection control. Cortisol is an immunosuppressant, which means that the client is at an increased risk for getting infections. So you need to very closely monitor the client for signs of infections such as fever. You need to be very careful with the client as far as their safety is concerned. Like Caroline said earlier, they can develop osteoporosis and spontaneous fractures, so falling is a big risk for these clients. And also because some of these medications cause hypotension, which can make them dizzy if they stand up too quickly. And the radiation, of course you want to provide skin care and assess for damage. You can find all of the journal articles that we have talked about today during our presentation on our reference page. Thank you for viewing our presentation, and this was Cushing syndrome.